Talk About You, brought to you by the USA Fibroid Centers, where we're dedicated to not only offering you information about fibroids, but also about fibroid treatments like the UFE. So join us each month for our open conversations, our honest conversations about fibroids, where we're going to help you through your healing journey. See you soon. And I want to definitely introduce you guys both properly. I want the audience to know who you guys are because you're both on live, and I want everyone to know who everyone is. So, of course, I am Brand Ambassador Kym Lee, but this is Dr. Kamil. She's Dr. Kamil J. Hazel. And tonight she is excited to be one of our guests because she is going to be talking about her journey with fertility and the health and her actual reproductive health, and what all of the strategies and tactics that she's taken in order to ensure that her pregnancy is a healthy one. And I am so excited because she has done so many wonderful things. So the fact that she has taken the time to join us tonight is certainly a great opportunity for us. But she is a theater actress. She was a theater actress and arts educator, and she is a reality TV personality from OWN Network's Ready to Love. And after being diagnosed with fibroids during her pregnancy the first time 16 years ago, now Dr. Hazel is going to share her story, how she's navigating her treatment process, and how she wants to preserve her fertility. So I'm excited to have you here. Welcome to the show. And I want to introduce your followers to Dr. Shiloh. He is our very own. Dr. Shiloh is my favorite, and no one else needs to know that, but he is my favorite. And he is a board certified interventional radiologist here at the USA Fibroid Centers with years of experience in our minimally invasive treatment, which is called the Uterine Fibroid Embolization. And he provides his services in Philadelphia, in Trenton, New Jersey, and Southampton, Pennsylvania. And so welcome to the show, Dr. Shiloh.
And also in Chicago, Illinois, by the way. So,
Oh, now let's add that to the list. Wow, you're busy. You're certainly very, very busy. And so we're so grateful that both of you have taken the time out during a holiday to come onto our platform. One of our mantras this month is give yourself the gift of good health. And so so many women I can't talk, neglect themselves, unfortunately, because we are wearing multiple hats. As you see, Dr. Kamil is wearing lots of hats. And we won't always take the time for our health. And she has done the opposite. She has taken the time. She is getting the treatment. She's doing all the things. And so we're going to talk a little bit tonight and kind of dispel some of the myths that have plagued the internet. Dr. YouTube has struck again and told us that we cannot have children over a certain age if we have fibroids. So we're going to dispel some of those myths from Dr. YouTube and all of those online doctors who have claimed to know all things. And so I definitely want to just jump right into this conversation. And I want you, Dr. Hazel, to tell us, how were your fibroids originally diagnosed during your pregnancy with your son?
So I went in for my normal, my monthly checkup with my son, and I want to say I maybe was about 3 months pregnant. And they told me that I had 3 insignificant fibroids. They said, it's nothing that I should be concerned about. If I wanted to handle it after I had my son, then we could handle it. If not, they weren't big enough. I think they measured at like 0.1 centimeter, and then maybe 0.2. They were very small. I wasn't worried about it. Really didn't have questions about it. I asked my mother, and she said that it ran in our family. She had them. She actually had a hysterectomy. But she told me, I was 28. She's like, you better not. You want more kids? You better not get a hysterectomy. Let's circle back to, I want to say like a year ago. Had one spell of heavy bleeding, didn't worry too much about it. And then recently I went to the doctor because I'm like, okay, I'm feeling fatigue, a fatigue that I've never felt before. I'm usually pretty healthy, pretty active, but it became naps. Like if I can get 2 or 3 naps in, I was good. Even when I would go to sleep and wake up after 8 hours, I would be tired. I went to the doctor. Didn't have any bulge or anything, so I didn't think that they were growing, but recently found out that they had now grown to 4 centimeters, 5 centimeters, and then one is 1 centimeter. And that's when I decided that I needed to go ahead and start treatment. And again, after 16 years, and they hadn't really been bothering me. I really didn't think they had grown that much, but they did.
Got you. So, Dr. Shiloh, for those that are watching who are interested in knowing some of the symptoms and signs, if you do have fibroids, I would like you to tell us exactly some common ways that fibroids are detected during pregnancy.
Well, I think doctor's story is very, very common in that, nowadays during pregnancy, we get routine ultrasounds fairly frequently, usually early on in the pregnancy to determine viability, to see that there's a baby that's got a heartbeat, then sometimes a little bit later, and then almost always at 18 to 20 weeks to look for the anatomy of the baby. And during those ultrasounds, you're not just looking at the baby, you're looking at the ovaries, you're looking at the uterus. So you will oftentimes diagnose other issues, including fibroids, which are extremely common. And so, yeah, usually they're just diagnosed with that. And I'm sure that also during a physical exam, the doctors, as the uterus grows, they can maybe feel lumps and bumps and bulges that shouldn't be there. And that would also lead to another diagnosis. Sometimes, unfortunately, in ultrasounds, we have these when the uterus contracts, it looks like a mass or a fibroid, so that it has to be repeated a couple times depending upon where it is. So women who have been pregnant know that their uterus contracts during times, and if we happen to catch those in that moment, they look like fibroids. So those usually there's an initial diagnosis made with a routine ultrasound during pregnancy, and then hopefully if the pregnancy goes successfully, then subsequently after pregnancy, then a diagnostic ultrasound is the most common way that we would follow up and see that there is in fact fibroids, and then try to quantitate them and see how many there are. Um, Ultrasound's a great test, but unfortunately, sometimes it actually under measures the number of fibroids, and it's also a user dependent test, which means that if I let 3 different ultrasound techs scan anyone, they're going to come up
Hmm.
with different sizes, maybe even different numbers. It's not as crystal clear as one might
Oh,
think. So, while you probably only have 3 fibroids, it's also possible you might have a few more. And I'm not trying to make you worry or
Oh
anything,
no.
but determine that would be easy enough to see how clear it is on the ultrasound. And we can get to this later, but at times when there's any question, we can go to more advanced imaging, like getting an MRI. There you can really see crystal clearly how many fibroids there are.
Right.
so I heard you say something about the size and location a bit. So, how can that affect the pregnancy if a patient is, in fact, diagnosed with fibroids?
Well, so there are ostensibly 3 different types or subtypes of fibroids, and they're based on location. I always tell patients that fibroid disease is like real estate, location, 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 right?
Okay.
So a small fibroid in a location that's underneath the inner lining of the uterus can cause heavy, heavy bleeding. So in
Mm.
her case, for example, it could be the 1 centimeter fibroid that's causing your heavy bleeding. We automatically assume that it's the big one, but it's like assuming the big kid in class is the bad one. That's not always the case. So it all depends upon the location of the fibroid. So there are 3 subtypes: submucosal, which is underneath the inner lining of the uterus. Those are the ones that cause heavy bleeding. Intramural, that are in the muscular wall, and then subserosal, which are on the outside of the uterus. Um, it's not always easy to really be certain which of them is causing problems, but in this case, sometimes larger fibroids can prevent, say, and submucosal ones can prevent proper placental growth and impede the growth of the fetus. Subsequently, subserosal fibroids tend not to interfere as much. So it's really the intramural and the submucosal ones, the ones that are actually inside the wall of the uterus, they tend to cause the biggest problems.
Wow. So what I think what I want to just kind of just help the listeners to understand, for those who are maybe perhaps be trying to get pregnant, or maybe in fact pregnant now that they come back and watch this. I want to talk a little bit about the larger fibroids and the greater quantity increase in the risk of complications, like for miscarriages or preterm labor and things like that. I know fetal growth restriction can also be an issue and could need have a need for a C-section delivery. Can you talk a little bit about that?
Yeah, everything you just said is true. You know, I think that when the fibroids are larger, and depending also on their location, I mean, we can get even more specific. Sometimes fibroids are low down near the cervix. Sometimes they can impede. Potentially, the concern is that they're going to be in the way when the baby tries to slide down that canal and during childbirth. So that's when those larger fibroids would be needed to be really looked at carefully in advance of delivery. To your other point, large fibroids are in fact a very frequent cause, and submucosal ones are in fact a frequent cause of miscarriages, which happen early on. So
Mm.
lots of my patients who desire babies and fertility have had frequent miscarriages, and a lot of times it's because of the inability of the embryo that gets fertilized in the fallopian tube. It's got to land on that nice fluffy surface on the inside of the uterus, the endometrium. And when there's a big mass underneath there, that can really be an impediment to proper implantation and thus causing frequent miscarriages. And then certainly can cause problems with, as you pointed out, intrauterine growth restriction and problems during delivery. And that's something that our OBGYN colleagues would be aware of course, and does lead to more frequent C-sections.
Yes, and with Dr. Hazel, I know that you were told by your gynecologist or suggested that you get the hysterectomy. How did that make you feel when you were given that recommendation? What were your thoughts? Because I know that you're a thought leader. I know you do your research. We've bonded on that. In our inbox on social media, you've done lots of research on this. How did that make you feel? Just being told, okay, hysterectomy.
Well, I always know, no offense, doctor, that I'm going to go to somebody else to see what other options are available. And again, my mother, when she got a hysterectomy, there were no other options. So I'm a researcher. I looked up to see what else could be done. Hysterectomy wasn't an option. When that was suggested, I was like, oh, okay, sounds good. But for me, I knew that that wasn't an option. And I knew there had to be something else out there. Again, it took me 16 years to figure that out, but thank God they didn't grow to a size where a hysterectomy actually had to happen.
Got you. And so, Dr. Shiloh, let's talk a little bit about why hysterectomies are so commonly recommended with fibroids, and what are some other treatment options that could be better suited for women?
Well, you asked $1 million question, and one that's a very complicated answer. I will say that there are over 400,000 hysterectomies done in the United States every year.
Whoa.
The vast majority of those are in women with fibroids.
Mm-hmm.
And though we have yet to discuss this, the vast majority of women with fibroids are women who are Black or African American. So there is a uh, medical social thing where women are being just told by their doctor, hey, you need your uterus out, and they're not given any other alternatives. And I think it's a sad state of affairs, to be honest. And I can't get into the minds of all the OBGYNs, but it is relatively pervasive that they just tell you this is all you got. And I could talk about this for hours and maybe say some not nice things, but the vast majority of my patients come through your type of initiatives, these Instagram lives, Facebook, etc. Women who are looking for an alternative to a hysterectomy, and maybe it was the only option 40 years ago, but UFE has been around since 1995. I've been doing them since 1998. It's not new. It's not young. It's the single most validated procedure there is. It's been compared to hysterectomy every which way. And frankly, there's no reason a woman like yourself should lose her uterus with 3 fibroids, where I can do a procedure in my office from an artery in the wrist or the leg in 20 to 30 minutes and have you out the door, a couple hours later. And you get to keep your uterus, you get to preserve your fertility. The uterus has other functions in the pelvis besides just giving birth. There are many, many reasons why you should preserve your womanhood, your fertility, and your uterus. Down the line, you don't run the risk of having hernias through the surgery, bowel obstructions, your bladder falling through your vagina. There's some signaling about increased risk of breast cancer and heart disease. So there's every reason to keep your uterus, and it's a shame that women are not given those options by the gatekeepers of their health, the OBGYN community. So most of our women come from the things that you do. So I appreciate that very much.
And I love that term you just used, the gatekeepers of our health, because they gatekeep sometimes even the alternative surgeries or alternative procedures rather that we could actually turn to, especially for those who want to have children like Dr. Kamil. And what people don't realize is that over half of women diagnosed with fibroids are presented with the hysterectomy as a treatment option, which is very unfortunate, because knowing that we have UFE, which is a uterine fibroid embolization, that's non-invasive, non-surgical procedure that you offer in 4 different states, right? 4 different places. This is an option that a lot of women are unaware of. They're unaware that they don't have to be down, don't have to have the downtime. They're unaware that they don't have to go under heavy sedation and all the things, and lose time at work and all of those. And they can potentially have children, still have children rather. There's a 99%, 98 to 99% success rate with this procedure. I want to not say surgery, this procedure that you offer, which is fantastic. And I think that, just us, like you said, having these conversations is so very important, because we need to enlighten and inspire women who feel like they have no hope. Like, this is it. I got a fibroid, no children. That's not the case. So I'm so glad that you clarified that. And I do want to go back to Dr. Hazel about your fibroid symptoms and how they progressed after you put off the treatment, because I know that you waited for some time before you decided to, just kind of look through some other treatment options. How did they progress after you were diagnosed with them?
Honestly, I would just say fatigue was the biggest one. And for me, it was just like I put it off for so long because I really didn't get any big symptoms. Like, it wasn't anything that was like not manageable, except for that one period that I had that was extremely heavy, where I bled through my clothes. Then I was like, okay, but if it didn't happen again. So for me, it was just like, okay, I'm not getting these huge symptoms, but fatigue definitely is an issue because I love my naps, and I should not love my naps so much, but I definitely love my naps. But I do want to get some of that energy back. I'm in education. I work with high schoolers. So, I'm done. End of the day, I'm done. I have nothing left.
Do you mind if I ask you a quick question? I hate to interject. Have you had a blood test done to see if you're anemic?
Oh, that's another thing. I get cold all the
Right.
time. Like, I have had a blood test done and they said that I'm not anemic, but yeah, that's another thing. But my extremities, everything is cold. My nose, my fingertips, my toes.
Well, maybe you haven't reached the borderline cutoff of anemia, but even if you're running at like a hemoglobin of 11 and normally you're at 15, for you, that's still a big change. So though you might not technically be anemic by the cutoffs of a lab, you probably are running like a little lower in your tank than most people are, and that's making you tired. A lot of women I find, they just say, this is how I bleed, this is how much I bleed, and they get used to it. And they, as you pointed out, they have a busy lives, they're managing 100 other things. And one of the things I'd like to tell women like yourself and others, you got to take care of yourself before you can take care of other people. And you're taking care of, your child and others and your work, everything else. And you got to put yourself first sometimes. And, with this procedure, for example, you could be, stop bleeding like you are and regain the energy that you have within a month or two afterwards. Many women feel great even after 2 weeks, I see very frequently. So, it's really an opportunity to take care of yourself.
Mm-hmm.
I just want to say one thing before I forget. I mean, Christmas is coming up, and one of my more fond memories of this company is that last year at Christmas, one of my patients had a baby. Sent me a text message like, "Good morning, doctor. This is my Christmas baby," and it was a young lady who had been
Wow.
trying to have kids for many years and had her baby on Christmas, and actually was fortunate that on New Year's Day I had a second patient have a baby. So it really resonates with me a lot, and nothing would make me happier than helping other women conceive when they were unable to do so.
Right.
I think that's so awesome. And I want to talk a little bit about these I call them little demons, like these little fibroids, and how they contribute to the symptoms like the heavy bleeding that, Dr. Kamil experienced a few months ago, that she said she had the anemia. And when should we ask for treatment? This is a Dr. Shiloh question.
Well, I mean, I think lots of women suffer in silence. Again, we call them silent sufferers. They suffer for years. Now, for you, it seems like just whatever. I don't remember exactly 6 months or a year ago you started having, or you had an episode of heavy bleeding. But there are women who have that for years. They complain to their doctor. Nothing is done. They're told, we'll put you on birth control pills, or do this or do that, and they just keep them waiting and waiting and waiting. I think until the women get so fed up with the problem that they're finally like, okay, well, we'll take your uterus out. And they're like, fine, I've had enough of this. So there's no reason to wait. If you start having symptoms of heavy bleeding, there's no great explanation for it, and pelvic ultrasound is a non-invasive way to find out whether you have fibroids or not. This week, I saw several women who met criteria. 2 of them had fibroids, 1 did not. So, but they came in, we did an ultrasound, we assessed them. And for some, there's an option. Others, there may be something else causing it. But if you have heavy bleeding, absolutely go get assessed. If your bleeding changes, get assessed. If you start having problems peeing, or you're peeing very frequently, this oftentimes means your uterus is big, pushing on your bladder, not allowing it to inflate like it's supposed to, and you're peeing all the time. If you start getting pelvic pains or cramps, severe pains that you didn't experience before, even constipation, pain down your legs, you know what? Just come get an ultrasound and an evaluation. There's almost no downside to it. Yes, there may be a slight financial expense. Clearly, it's the way medicine works, but a limited ultrasound examination and a meeting with a doctor can at least get you in the path towards figuring out whether you should or shouldn't be treated.
Right.
And you know what, Dr. Hazel, you went and you have been continuing this journey, but a lot of women, on average, it says that 3.5 years they wait after they're diagnosed with the fibroids. I waited 12 years after I was diagnosed with the fibroid because my schedule
Right.
was too busy. And I just allowed all of the symptoms that I was experiencing to be part of my daily life, with popping the pain pills and eating all the sugar and really just feeding the fibroid and nursing it just to keep it quiet or keep it, tolerable and manageable. It just was not a healthy way to live. And so, I really, when I was talking to our director at the Fibroid Center, I was telling her how you were really actively seeking treatment and help so that you could actually have a healthy pregnancy, along a full-term pregnancy. And so I definitely want to congratulate you on that and not waiting and not, procrastinating through this process. But a lot of women unfortunately don't, for the various reasons, and I'm not ashamed to say it. So I definitely want you all to know, if you're watching me, to not wait. You don't have to wait. And like Dr. Shiloh said, you don't have to suffer in silence, because we do have answers. There is help, and you do have options. Hysterectomy is not your only option. And so I'm glad that the USA Fibroid Centers has allowed us to have this time and this platform. But Dr. Hazel, I do want to ask you, when you spoke to your doctor about the UFE, I know we talked about that briefly. What risks did they talk about in terms of your future pregnancies?
Well, they actually said that I may not be able to get pregnant after having the UFE. But this was also coming from a doctor that performs the myomectomy. So
Uh-huh.
she was that way, definitely. I understood what she was trying to do, but she definitely was like, she's quoted, she said it wasn't anything that was, I don't want to misquote her. She couldn't specify why that it impacted pregnancy, but she just said that it's been said that it cuts off the blood flow to where you probably or maybe wouldn't be able to get pregnant.
So, Dr. Shiloh, can you speak to that? I want you to tell them why the UFE is a viable option for women that are looking to preserve their fertility.
Yeah, that's a very common thing. The OBGYNs like to tell everybody you can't get pregnant. Data and science trump everything. That's the way I believe.
Mhm.
So there's lots and lots and lots of studies that have proven that you can get pregnant after having a fibroid embolization. They like to tell you that you can't, but you can. In fact, there was a big meta-analysis done where someone looked at 17 to 20 studies about this, and they found a cumulative pregnancy rate of about 39 to 40% in women who desire pregnancy after UFE. There are so many variables. Obviously, as women get older and they get to be over 40, for example, the possibility of getting pregnant diminishes in and of itself, with or without fibroids. So those are the main issues, really, the age of the patient that at the time when they want to desire fertility. But there are many studies that have compared, there's even studies that compared myomectomy to UFE, and they've had similar pregnancy rates. So they just like to say that because it sounds good, and they're not going to, you're expecting you not to question that answer. But the fact is it doesn't take much but to look up, studies. And oftentimes I'll share those studies with my patients, say, look, read them yourself. Sometimes it's, maybe a little technical, but you can look at these studies and you can see there was a big study came out of Europe. They looked at 359 women. And over 10 years, they had about 40% of those women were able to get pregnant, 40,
Wow.
42%. Again, it's not
Right.
100%, but neither is myomectomy. And, myomectomy increases your risk of having a cesarean section. There's also
Right.
scarring that takes place. Some of the myomectomies actually require a true C-section incision in the uterus to remove the fibroid. The other downside is that, like I said earlier, spoke to earlier, you believe you have 3 fibroids, and you may, and without looking at your imaging, can't say one and another. However, if they went after the 2 biggest fibroids and left that 1 centimeter fibroid, it's possible that in a year or two, that 1 centimeter fibroid is a 3 or 4 centimeter fibroid. With UFE, all of the fibroids get treated simultaneously. Whether you have 1 fibroid, 3 fibroids, or 30, they all get treated at once. So I see lots of women who've had a myomectomy. A year later, they come back to me and they're in my office saying, "I had a myomectomy. They must have grown back." No. They just didn't take out all the fibroids. They left all the
Wow.
peanuts in there, and they all come and those grew. Sort of like if there's a big tree in the forest and there's little saplings underneath. When that big tree gets felled or whatever, then all of a sudden those saplings get all the light, they get all the nutrients, and those things can start to grow real rapidly. So it's not uncommon for me to see patients who've had myomectomies who just keep saying, well, I'm just going to suffer forever because every time they do it, they keep coming back. No. They just didn't get them all the fibroids out, and they just grow. The ones they didn't get out grow again. So I'm not saying myomectomy is not an option. It can be, and for some women it is, but there are alternatives that are non-surgical with a shorter recovery period, no incisions, no cutting on you, nothing's coming out, and you retain your uterus for the possibility of pregnancy as well as for the functions it has in your pelvis down the line in
Right.
life.
Wow, Dr. Shiloh, that's so good. I wish I could just bottle that up and send it to everybody that I know who has had issues with their fibroids. So I want to just reiterate something that the uterine fibroid embolization, the UFE, is a fertility preserving procedure that leaves the uterus intact. So that in and of itself, Dr. Shiloh, was worth the price of the
Right.
trip. Okay. It is a procedure that leaves the uterus intact and it allows women to conceive after treatment. So this should be an indicator. You guys heard it not from me, not from Dr. Hazel, but you heard it from Dr. Shiloh, who is our interventional radiologist. This is our doctor. He's telling you the facts.
Right.
And I appreciate that, Dr. Shiloh, because so many women, I think that's probably the biggest question that I get asked by women all the time. I was at a Christmas party last night and a girl stopped me at the Christmas party with the band playing and glasses clinking, and she's asking me about her fertility at the Christmas party. And I was like, we have to talk about this off the record because the information I want to share with you is too important to have over your cocktail. Like, you need to hear this in all clearness of head and mind space, and you need to understand the severity of the lies you've been told, because you definitely have some options. So this is so good. So I want to talk to, I have just a few more questions before we wrap up. But Dr. Hazel, I want you to tell us if you're planning to find out more about your fibroids through the diagnosis, like doing another MRI. Are you interested in doing
So
that?
I actually have an MRI on the 31st. And again, that was ordered just to make sure of the number of fibroids that I have. And I want to say after that, I'm going to go ahead and go through with the UFE. So I'm
Right. All right. And I want Dr. Shiloh just to explain to the viewers exactly the role that the imaging of the MRI plays in planning the fibroid treatment. I think that's going to be very important and how it can guide in personalized care. So if you want to tell us a little bit about that.
Yeah, I mean, usually what I do is if when a patient comes in and has their ultrasound, if the ultrasound's very clear to me and everything's matching, their symptoms match, and the ultrasound findings are clear. You have heavy bleeding, you have a submucosal fibroid, it's clear, I can see it. I may not order an MRI. Conversely, if you came in and said, I have heavy bleeding, but the MRI, the ultrasound's a little vague, I can't see exactly why, I'm going to order an MRI to see a little better. If you have very large fibroids and I want to see exactly where they're located, then I might order an MRI. Some women also have another condition that at the same time called adenomyosis, and we see both of them often. So I sometimes send patients for an MRI. They come back with fibroids as well as this other condition known as adenomyosis. The reason it becomes important is that adenomyosis and fibroids are very similar in their symptomatology. They both cause heavy bleeding and pain, but they're not the same. And adenomyosis is a growth of glands in an area of the uterus called the junctional zone. And if we see the adenomyosis, then we can treat both of those problems simultaneously by changing a little bit of our technique, but we can actually treat both problems simultaneously. So when you have that MRI, it's possible they may find that you have adenomyosis as well as fibroids, and then whomever does your UFE would probably alter the way that they do it a little bit, in that they want to treat both problems at the same time.
Wow. Sounds like Dr. Shiloh is your doctor. Let
so
me not, let me
are you
not push him off.
are you able to forego if you are you able to tell your doctor that you don't want the MRI and just go straight into
Sure.
the procedure?
Absolutely. I'm, I don't mean to sound this way, but I mean, I usually decide whether you do or don't need an MRI. Now, sometimes some women really want them and I'll order them for them, but there's a financial implication of it. I mean, the MRIs aren't cheap. And if you don't need a test, so I learned early on in med school, you order a test when it's going to change what you're going to do relative to
Mm,
going forward. So if I see your ultrasound, I'm like, no, 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 you're very crystal clear, 3 fibroids. And
okay.
even if I'm like, well, maybe she has 4 or 5, again, it's irrelevant to me. I'm treating your all your uterus, not individual fibroids. So I'm going to treat them all regardless. However, if I said, as I said, if there's a disparity between your symptoms, the fibroids, I'm not sure. Then I suggest we get an MRI.
Okay.
Many women are like, once they've reached the point of wanting to be treated, it's time. And if I'm not trying to put another hurdle in front of you, both time wise, financial wise, to
Right.
get treated.
Okay.
So I don't make a determination like you must have this beforehand. I only do that when it's absolutely necessary.
Okay. That's good to know. Thank you.
It's
Very good to know.
it's certainly helpful to see them. They're very clear. I can
Right.
show you on your MRI, here's your fibroid, here's your fibroid. It's a lot harder for patients to see ultrasounds. They're just a series of black and gray. But an MRI, that's like a high definition television.
Mm.
And I often do. I'll just be like, here's your fibroid. This is the thing that's causing you to feel the way you
Right.
feel. And it's very powerful, I think, when you finally see that problem you have inside of you and say, well, you know what, in a couple months, this thing's going to be shrunken down like you take a big fat grape and turn it into a raisin. So the fibroids, just to be clear, don't after UFE don't disappear completely usually, but they shrink about 70 to 80% of their overall volume. So, if you have a 4 centimeter fibroid, it'll shrink typically to 2 centimeters. It sounds like 50%, but when you look at a volume of a sphere, that's actually a 70 to 80% reduction in volume.
Okay. So
Wow.
they don't completely, because the information I was given is that they like break off in pieces.
Not usually. So only women who have large submucosal components or an intercavitary component, which is to say it's inside the uterine cavity, will typically give birth to bits and pieces of fibroids. Most women do not deliver any fibroids. The fibroids simply shrink in place, shrivel up, and get smaller, and they become devascularized, and that relieves you of your symptoms.
Mm,
So some women will give birth to fibroids, but most do not.
okay. Okay.
Wow. I didn't know that, Dr. Shiloh. I actually think that's very good information to have. And for those who are unclear about what an actual MRI is, these are details that we need to share. And that is that the MRI is ordered by the doctor. And what this does is it provides a detailed image of the uterus and can be accurately identify the fibroid in the size and the location. So this is something that, of course, your doctor can order for you. But again, as Dr. Shiloh said, keep in mind, it could be, it could be very pricey. And so if the insurance is not covered, then what are the other options? Like, how would the doctor know if they're not able to do an MRI? If the insurance doesn't cover, or is that normal? Will the insurance normally give you one, or is it like, are there any, do you even know that, Dr. Shiloh? Like, are there anything we need to be worried about?
No, we typically don't have trouble
Oh,
getting an MRI
okay.
approved. Usually, patients start with an ultrasound. It's quick, it's easy, it's portable. You can have it done. But the ultrasound is only as good as the ultrasound technologist who's doing it and the person interpreting the imaging. So the MRI is a little bit more reproducible. You can have an MRI just about anywhere, and they're going to look very similar. But as I mentioned earlier, most patients, can have two different ultrasounds by two different people. So I even often caution patients who think, well, it did grow, it shrank, I did this. I'm like, no, you're talking about a difference of 6 months. It went from 4 centimeters to 3.8. No, it didn't shrink. It's just whoever put the calipers on there or the way the tech took the picture. So ultrasound's a little bit trickier, but in my office, for example, I've been working with the same ultrasound techs now for years. I trust them implicitly. I go back in sometimes and scan. We do a transabdominal, also endovaginal when as necessary. And then only if those images are not sufficient is when I request an MRI, and then our office goes through the process, gets it pre-authorized, helps you schedule it, and then I personally review all the images myself. So I have patients come back with their disc in hand. I can look at my computer, show them their MRI, and then we go from there.
Okay,
Gotcha. Wow.
another question.
Sure.
So say that I get the MRI or I don't get the MRI. Will it still treat? I see somebody up there said they had 11. Will it treat all of them regardless of not getting the MRI?
Yes. So just to be clear, when we do a uterine artery embolization or uterine fibroid embolization, we're putting a catheter into the left uterine artery and the right uterine artery. We're then non-selectively embolizing all of the fibroids. What that means is we don't have to go in and find fibroid 1, fibroid 2, fibroid 3, 4,
Mhm.
5 individually. We are taking out the left half of the uterus and going back in and taking out the right half of the uterus. So both sides, like a yin yang, are covered by the embolization. So sometimes a fibroid, women will say, oh, it's on the left side. Amazingly enough, the blood supply comes from the right. So it's not individual. You don't need to know which ones are there. The reason to know is if, for example, you have a submucosal or intracavitary component, and then I can counsel the patient like yourself and say, you know what, in your case, keep in mind in a month or two you might start to give birth to pieces of fibroids, versus in other women's cases I'm like, that's not an issue, it's not relevant. But yeah, like I said, if I reviewed your imaging and thought, nope, you're ready to go, you're fed up, you got time, we don't have to go through that step.
Okay,
It's just women who have specific issues that we request those
got it.
tests.
That's such good information. I mean, I have, I know, I'm in awe. Like, I wish you could be on here every month with us for these questions, because these are things, again, we have people who are, commenting in the comment section, and they're only going by what their doctors tell them, and unfortunately many of their doctors might not be the specialists. And so having you here is really a great thing for us to be able to ask you these questions. So I want to ask you some final questions before we jump off tonight. Dr. Shiloh, I wanted to know, what should patients know about balancing the fibroid treatment with future fertility goals? What should they know?
Well, I mean, I try my best to, look at each patient on a one-on-one basis individually and look at what their goals are and try to figure that out. So, some women, it may be that they come in, they have a single solitary, fibroid that can be reached hysteroscopically, which is, let's say, through the vagina and can be scoped out. that might be their best choice. Other women who have 10 or 11 fibroids, 15 fibroids, you know, and their uterus is almost the size of a 20 centimeters, which is 5 months pregnant, you know what? Their best choice is not going to be that surgery. So you have to really individualize that.
Oh,
What I do is that we discuss all those options. We talk about whether or not they would prefer that or myomectomy. You go over all of the risks and benefits of both procedures. The patients I have found who've done really well have basically have had the procedure. And the one woman I mentioned had a 20 centimeter uterus with huge fibroids. So it wasn't just I'm cherry picking a lady with one fibroid that's 2 centimeters and she got pregnant. She had a really large uterus with multiple fibroids and still conceived and had a normal term pregnancy. But we tell them to wait about 6 months to try to get pregnant. It used to be a year. Most of my patients who have gotten pregnant have been successful, you know, having, you know, getting pregnant at around 6 months. You know, you want to give the fibroids time to shrink. It takes about 3 to 6 months for the fibroids to shrink. Now, could they get pregnant a little earlier? Probably. It's very difficult to tell. Those studies are impossible to do. But I tell them, listen, if you want to get pregnant, this is your time. So after 6 months, go for it. Similarly with myomectomy, I don't think they tell women straight away after myomectomy, you know, a month or two later, time to get pregnant. They often let them give them time for everything to heal as well. So bottom line is it's got to be individualized for each patient based off their age, risk factors, size of fibroids, location, and their ultimate goal. And, you know, I do my best to try to work with them and give them the options. And, you know, some women select to have myomectomies, and that, you know, that's for them. I'm a firm believer that it's your body and it's your choice, and you get to decide. It's my job to guide you the best I can. And you know, if I can help you, great. If someone else can, it's also great. As long as you seek treatment and get the treatment that you deserve.
absolutely. And please make sure if, you know, Dr. Shiloh he's on his social media. So if you have any questions, I'm sure you could probably slip into his DM if he has time to answer your questions. But you could also call our number at the top of the screen if you do have questions about your fibroids. We're happy to answer those questions about your fibroids. Dr. Kamil, are there any closing remarks that you want to encourage those that are following? You've had quite a few people on tonight from your following, and we appreciate you all for logging in. So is there anything you want to leave during this holiday season? Any advice or any words in closing?
Just make sure you stay on top of your health and your wellness. And that's not just with your uterus, but just your overall health. Make sure you're getting your yearly, your annuals, and staying on top of that. Health is wealth always.
Absolutely. Dr. Shiloh.
I would like to echo that and just say that, you know, women are amazing. They do take care of a lot of people in their lives, and you really have to take care of yourself. Oftentimes you have to sometimes put yourself first and make sure that you're getting the care that you need. If you're, you know, in your 30s and 40s and you suddenly start having heavy bleeding or new onset pelvic pain, you know, don't wait, get it evaluated. There's no reason to suffer for 3 years, 12 years, or any amount of time. You know, get it evaluated as soon as you possibly can, and you know, hopefully we can get you on the road to recovery if it's appropriate.
And also, I just add, get a second opinion. Like, just don't go for what the first doctor says. Get a second opinion, a third opinion sometimes.
Very good
Right.
advice. Very good advice. Well, I am grateful for the knowledge that our doctors have here at the USA Fibroid Centers. This is USA Fibroid Centers. We actually specialize in the UFE, which is a uterine fibroid embolization. However, we thank goodness for our founder, Dr. Jan Katz-Nelson, who has allowed us to be able to have these conversations, because it's not just cut and dry with a fibroid conversation, but we have to talk, like Dr. Shiloh said, about the MRIs. We have to talk about fertility. We have to talk about other things that actually surround the fibroids. So we need to have these conversations, and this is a safe and an informative platform. And for more information, you guys can definitely reach out to us. We have resources and educational information about pregnancy and fibroids. If you visit our website and our blog page, and if you have any questions about fertility, any at all, and about fibroids, make sure you schedule a consultation at one of our centers. I pinned the number at the top of the screen, and that number is 833-609-1100. That's 833-609-1100. Or you can visit our website at usafibroidcenters.com. gmail.com. I hope that this has been informative and enlightening for many of you and encouraging. It has been for me. And I'm just happy to know that women do have an option and that there is a way for you to extend and have a healthy pregnancy just by having these conversations. So thank you, Dr. Shiloh. Thank you, Dr. Kamil. I appreciate you both so much. And for those of you that are watching, thank you for tuning in to Talk About You. If you have any questions about anything we talked about, please inbox us. And any ideas, anything you want to discuss, it might be something you want to talk about as it relates to your uterus. I'd love to hear about it, and I'd love to have you on our show. So make sure you inbox us and let us know. And until the next time, happy holidays, everybody. Everyone have a wonderful and a safe holiday. Thank you so much to both of you.
Thank you.
All right.
Have a great
Good
night.
night,
Thank you
everybody.
so much.
You're welcome. Thank you. Good night.